frankly, this is really a hospital for the 21st century. I'm just really pleased that people have prioritised a community hospital above us all having to go a longer way up to a district general hospital. It does make sense to get services delivered locally in financial terms as well as for people terms and what people want for their healthcare. So it's quite ambitious. There's a lot of work to do, but I think there's a possibility that we could really make the area thrive as a health community through this hospital. In the outpatients department, there's an increased range of facilities, so we'll be able to have more specialties who are more specialised consultants seeing patients. And then the other thing we've got, of course, are 20 inpatient beds. Every person that will be admitted here will have a single room now with their own ensuite bathroom facilities. And each of the rooms has an external window, lots of natural light. And to be honest, the improvement in standards for inpatient beds is vast coming here. So I'm really excited about that. Just around the corner there's going to be a facility to plug in mobile chemotherapy, so people won't have to go up to Cheltenham to get their chemotherapy. They can just come a couple of miles, park easily without having to pay, have their chemo and go home within an hour. So for people, patients with cancer, this is going to be a huge step forward in their care as well. And in terms of the MIU, we'll have an X-ray facility. They'll also have a facility to bring a mobile MRI scanner so that people won't again have to go up to Gloucester for MRI scanning. They can come here. On the first floor, just above that entranceway there's going to be a large physiotherapy unit. We've also got some social care that's going to be based within the hospital, so it'll enable people to actually stay at home with all this support much longer than currently they can. And generally that's a good thing, mainly for the patients, because most patients prefer to be at home. It also costs less in terms of commissioning spend, and so it's a situation that actually will lead to improvements all round. So all in all, I think for the people of Berkeley Vale area, this is going to be a huge improvement in their healthcare. As part of this scheme as well, we're just developing a service which will look into investigating and then treating people and hopefully get them back to their home that same day rather than have them admitted to Gloucester. And this is part of the service that will come out of the new hospital. And again, it's something about getting patients looked after locally by people that know them and who know local services. And I can see it as a way of really developing what we have locally and making sure that actually the health service around here actually starts to thrive even more than it has been.